Welcome to the Physio Rooms Woodvale. Today we are going to be talking about knee osteoarthritis and how to exercise safely and effectively when you have that diagnosis. So first of all, knee osteoarthritis, or OA as we'll refer to it from this point on, is a really simple diagnosis. So it's just loss of cartilage within the knee space. And essentially, if you've had a diagnosis made by your GP or your physio and that's been maybe confirmed by some scan findings and the two correlate really well together, then we can be fairly certain that there's going to be some really important things that can help. So the first thing is going to be weight loss, and the second thing is going to be strengthening your quadriceps muscles, which are these muscles in the front of your leg. Now, the question we often get asked in clinic by patients is, how do we exercise, how do we achieve weight loss, how do we achieve strength gain in the quadriceps when we've got a really sore knee? So today we're going to try and answer some of those questions for you and give you some great ideas for incorporating some exercises.
So the first exercise we're going to show you that you can modify is on the leg extension machine. The great one about this one is that it really isolates the quadriceps muscle, and building the strength in that in turn supports the knee and takes the stress off the knee. So it's a really good one for an arthritic knee. Now the problem is that obviously sometimes it can still be painful. So the first way we would modify it would be reducing the weight, so it's not too much on your knee. The other way would just be to modify the range. So if you could get all the way up with no pain, then fantastic. But if that's too painful, we just get you to take it to wherever you could tolerate that pain restricts you without pushing it above that 3 out of 10 limit.
Okay guys, so the next exercise we're going to show you is a squat. So a squat is fantastic for strengthening your quads and getting your glutes activated as well. But the other thing that's nice about it is that it's weight bearing, so we're putting a little bit of force through the knee itself. Now a squat is often intolerable for people that have got knee OA, so the most simple way to modify it is to use some support behind you. So in this instance we're using a box, and we can come down, we can sit on the box and have a little bit of a breather and then come back up into a standing position. So essentially we're turning a squat into more of a sit to stand movement. This is a really easy one that you can do at home as well.
Something else we'd like to talk about that we see commonly in clinic is that people with knee osteoarthritis are often quite anxious or apprehensive to move or to load up that knee due to the pain they've had and possibly the fear that they're doing more damage. It's actually really good to think of the knee as something that needs to be loaded and it is quite robust and durable, and that you're not going to do more damage by exercising the muscles around it. In fact, introducing those exercises will help to build up the confidence in the knee, the support around it, and as a result that pain in the knee becomes less sensitive, more tolerable, and you as an individual will improve your function as well. So in summary for today guys, the message we're trying to send is that it's not only safe to exercise with osteoarthritis in the knee, it's also really important to help build the strength around that area to support the knee and help settle the pain, as long as that exercise is within your pain limits and it doesn't flare up the knee for days at a time or make it feel worse or make you more anxious to move it or exercise it.
So thanks for watching guys. I hope you've really enjoyed this video, and if you want to get in touch with us, feel free to do so via Messenger or just underneath this video. Please look out for next week, where we're going to talk a little bit more specifically about shoulder pain and how we can exercise into that shoulder pain for rehabilitation purposes.